to place an NG tube in my patient and then apply the patient to suction via the NG tube. First, I'm going to verify my order. I have an order from the physician to place a NG tube on Mr. John Doe, which will require low wall intermittent suction. I am going to assess my patient's medical history. Mr. Doe, do you have a history of broken nose, deviated septum, or recent oral or dental surgeries? I would assess the patency of his nares. I would have him plug one nostril and breathe, and do the same with the other nostril and breathe. I would assess his nose with my pen light for patency, skin breakdown, and lesions. I would also try to choose the larger nostril for placement. I would identify my patient prior to assessing my patient upon entering the room, and he is Mr. John Doe, birthday 5/9/90, and that matches his medical records. I would perform hand hygiene and provide for privacy. He is alert and oriented. He is talking to me. I would assess his abdomen and respiratory status. I would first look at the abdomen. I do not note any trauma, masses, or abnormalities. I would listen to his bowel sounds and lung sounds in all 4 quadrants for 3 to 5 seconds. He has hyperactive bowel sounds. Lung sounds are clear and equal bilaterally. I would palpate his abdomen. He does have tenderness in the upper epigastric region. I would gather all of my equipment. I have suction, gloves, tissues, drapes, NG tube, lubricating jelly, measuring tape, markers, silk tape, a pH test, drinking water, and a graduated cylinder with a syringe. I would explain the procedure to my patient. Mr. Doe, the physician, Dr. So-and-so has ordered that we place an NG tube to hopefully alleviate some of your gastric discomfort. The tube goes in your nose and into your belly, and it will be put on suction, which will remove some of those yucky contents causing you your abdominal pain. Do you have any questions? During the procedure, if you have any issues, just raise your right hand and I will stop and give you a break. I will have you drink water during the procedure to help the tube go into your stomach. I would put on my clean gloves and I'm going to measure the NG tube. Open my NG tube, and I'm going to measure from the nostril around the ear into the xiphoid process. I have it measured at 55, in which I will place tape so I will remember my markings. I hate silk tape. Okay. I'm just going to keep going. Okay, so it's tape there for a marker. I would lube the distal end 1 to 3 inches. I'm going to have my patient in a high Fowler's position, and I'm going to start inserting the tube. Mr. Doe, when you feel like you're going to cough, tilt your head towards your chest. He is tilted back at this time towards his pillow, and I'm going to start progressing the tube. And he starts to cough. He does have his drinking water. As he drinks, I'm going to insert the tube 1 to 2 inches each drink. And as he coughs, I'm going to instruct him to tilt his head towards his chin. I'm going to progress the tube. Drink, 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 drink until my marked area. I'm going to temporarily tape this to his cheek And at this time, I would have X-ray come in to verify placement by X-ray. I'm going to uncap the tube, aspirate 30 to 40 mLs of gastric content, and assess the gastric content for color, potency, and type. And I would recap to prevent leaks. And I'm going to check the pH, which should be less than 4. And I would listen to lung sounds, observe for respiratory distress, and then I would secure my tube, which is capped at the end. With no bridle available, you would use tape to secure the tube to the nose. I would remove the temporary tape to prevent skin breakdown. I would measure the tube with a permanent marker, and I would clip the tube to his gown. I would provide oral care or educate him on how to provide oral care himself. I would remove my dirty gloves, and I would document the entire procedure and my findings. Then I would put the patient on suction. I have wall suction here. I would change to intermittent, and it is connected from the suction to the canister, from the canister to the patient. I would apply clean gloves and explain to the patient why we suction and that the physician has ordered this. I would test the suction with a gloved hand. Since it's turned to intermittent, I want it to be between 20 and 40, and we are successful. I would remove the cap, insert the suction, and I would observe that the suction is successful. And I would observe the contents and document my findings. I would perform hand hygiene, and I would reassess the patient at least every 4 hours as he is on suction unless otherwise stated by physician order or facility protocol.